Dr. Coker holds a number of memberships, including in the Medical Society of Delaware, and is a fellow of the American College of Surgeons. She enjoys mentoring students and currently serves as the board president of the Kumba Academy in Wilmington, Delaware. Thank you and help me in welcoming Dr. Coker. Now, here is a great introduction of Dr. Coker, a PSA that she did for Delaware State University.
What I love about Delaware State Hornets is that's a body of students that lead. So thank you, Delaware State, for always being the leaders in this community that we need you to be. Now let's talk about the vaccine for just a minute. There is no COVID in the vaccine. You can't get COVID from being vaccinated. There is no DNA change that's going to happen with you. We love you just the way you are, and we're not promoting anything that's going to change anything about you, especially your DNA. There is no tracking device. We don't need to track you. You guys have cell phones. We know exactly where you are all the time. There's no tracking device in the vaccine. None of that. So let's get rid of the myths. And what we're looking forward to, what I love about the students at Delaware State University is they get it. HBCUs, we are family. So we got to vac to get back because we want to embrace each other between classes. We want homecoming the way it was. We want the step shows the way they are. We are who we are. We are family. And that's what we do at HBCU. So let's vac to get back to what we love to do. It's all about family. We're all in this together.
Dr. Coker, can you tell us more about your work with COVID-19 during this current pandemic?
So we were alerted back in March that we needed to stop scoping patients, and we had to be very careful because many of the doctors who were passing away in Wuhan were ear, nose, and throat doctors, because everybody we see has a sore throat, has a cough, has an upper respiratory infection. So that was the first stop that many folks were making in China. So our academy alerted us, like, listen, if you don't know exactly what's going on with that patient, you probably should not put a scope in, because it requires us, when we scope patients, to get pretty close. So we got that information, and then we had to quickly go to a Zoom forum, basically telehealth. And after that, it was just crazy. I remember, because I'm the president of the board at Kumba Academy, which is a small school, charter school in Wilmington. And we had a teacher that had gone out of the country and had come back sick. And so the question was, he was waiting for his results of his COVID test. Should we shut the school down, or should we just keep it open? And so for me, very early, I made the decision, like, listen, if he's positive and we knew something and we chose not to shut that school down and do a deep cleaning for a deadly virus on students, kindergarten through 8th grade, shame on us. So I shut the school down on a Thursday. And then that Monday, the governor shut the schools down completely. So we were sort of very sensitive very early, despite all that was being said from the president of the United States, which was just kind of poo-pooing the whole thing, which for us, we knew it was much deeper than that.
Thank you. So when did you first hear about COVID-19?
I would say when everyone else was hearing about it, like January, February, but then in March, that's when we got the official statement from our academy, like, ooh, be careful. So it wasn't that we knew as early as we should have all known, but one of the guys in our practice had a good friend that was working at the White House on the task force. So we had some inside information, and we were working just to secure PPE equipment for our staff and for the state. And I can remember talking with my friend Neil Hochstein, and I said to him, we were actually walking our dogs because we're neighbors. And I said to Neil, he was going on talking about how he needed to do this and he needed to do that for Christiana Care and our practice and everybody to make sure we all had what we needed. And I just looked at him and I said, I don't think HBCUs are going to survive this. And he was like, first, tell me what an HBCU is. And so I told him, and I said, it's a historically Black college and university. And so I explained to him why I thought we would not survive this. And it's basically because we don't have the endowments, we don't have the funding that many of these majority schools have. And so he said, you know what, jump on a call with me at 5 o'clock. And so I got on that call at 5 p.m. and it was a group called Testing for America. And these were scientists from all over the nation that were working to create a testing protocol so that people could get back to work and back to school safely. And they were brilliant minds from all over. And so at the end of the conversation, they asked me to talk about HBCUs and what was going to happen with them. And when I finished the conversation, the CEO of the company, and this was a newly minted company, needless to say, he said, you know what, Joan, based on what you just said, we're going to start our program in the United States, and we're going to start with HBCUs, and we're going to provide testing at no charge to any HBCU that needs it. Now, you know, for me, I was like, I can cry thinking about it, but it was huge. And so we started with Delaware State, and I got to tell you guys, I mean, I'm just proud of you because even though it felt like a hassle and it was annoying for you, you really helped set precedents for the nation. And you guys have actually written the protocol that every HBCU has received as to this is how you safely reopen university. So kudos to you.
Thank you so much, Dr. Coker. I want to come back to Del State's response later on in the conversation, but I want to talk to you a bit about vaccine hesitancy.
Yeah.
So vaccine hesitancy is widespread throughout the US in different communities. And you've addressed this. You addressed this in the PSA, you've addressed this in other areas. What can you say to those who are still on the fence about getting the vaccine?
I can say that what's happening right now, and many of you see that really very clearly, is that 98% of the folks on ventilators and requiring prolonged hospitalizations right now across this nation are unvaccinated. The vaccines aren't pixie dust. So might you still get COVID? Absolutely. But all you really want to know is that you'll survive. And many of you may have had COVID in the past. So it's just like, I survived it the first time. So I know I'm good. I have antibodies, and you might be accurate. And that's grace and favor that sustained you through that first battle. But we have seen paramedics, police officers, physicians, nurses, respiratory therapists who got it a second, third time. And sometimes on the second or third time, they either passed away or needed a ventilator. So this virus is really, really, really a dangerous virus. I consider myself to be healthy. I didn't even get a flu shot every year. And I've been a physician for over 20 years. And I think I can count on one hand how many flu shots I've gotten in my lifetime. But what we recognized very early in the game was that it behaves very differently in everybody. So even though my grandmother may have survived it, my dad, my mother may have survived it, it doesn't mean that I will. And it doesn't mean that I'll survive it a second time or a third time. So whatever you can do to put a weapon in the toolbox such that should you unfortunately get it, the likelihood that you will die is far less is what it's all about. But I'm going to say this to you. I had a patient come in last week, and she was from Jamaica. And we were talking about the COVID virus. And she said, here's the thing, Joan, this is a global test. Because in life, you know, the bottom line is I am my brother's keeper. And so as soon as we get that message that it's not about you, it's about those around you, and we start to look out more for one another than ourselves, then this virus will go away. And until we globally get that message that we need each other to survive, we're going to keep moving from one variant to the next, one mask mandate, one vaccine mandate to the next. And perhaps this might be our new normal, or we'll finally get what we need to get from what this virus is trying to teach us and move past it. So that was a very interesting conversation that she and I had. And I think she's absolutely right. I do think that this is a test to help folks understand it's not about you. It's not about you at all. It really is about you being there for someone else and those in your life that you may not even know, but that matter to you.
Thank you. Do you have any additional advice for those who may have been vaccinated or are planning to get vaccinated, but they have family members or very close friends who are either quite hesitant, refusing to get it, or just completely anti-vax?
Gotcha. Yeah, the anti-vaxxers are real. I see them every single day here. And sometimes you just got to keep talking, because it might just be the right day, the right time, and the right conversation. And so what I need folks to do that are holdouts is to just walk the whole thing out. And what I mean by that is, if you have a child who no longer or doesn't have the choice of being vaccinated because they're age 0 to 12 years, you don't have a choice of vaccination. And should something happen to that child or that elderly grandparent that may have gotten vaccinated but didn't get the response that they were hopeful for, or that friend or family member going through chemotherapy because they've been diagnosed with cancer, and so they're trying to survive and they got their vaccination, but they're still in treatment, so their immune system is kind of all over the board. You walk into their home, you hug them because you think that'll make them feel better, and then you accidentally get them sick because you had no idea that the virus was in your body, and you accidentally get them sick. You have to be okay with the decision to not have that young person vaccinated, especially if you are the parent making that decision. You may not be able to get into the ICU. You may not even be able to get into the hospital should they be hospitalized, because AI is not playing. If you have not been vaccinated, you are not coming in. I don't care if you're mom, dad, grandma, you're not coming in, because they've got to protect their staff and they've got to protect those children that are there being treated. So you've got to walk it all the way out and make sure that you are okay with the decision that you make, no matter how it ends, and that you can live with that decision. That's the big deal.
Absolutely, absolutely. I want to talk to you a little bit about Dell State, and then I want to talk a little bit about your undergraduate training.
Okay.
So Dell State, you're right. Dell State was a pioneer in testing, but even now we're back to campus. We're back. 80% of the classes now are in person. We have testing, we have contact tracing, we have a quarantine space, but also just how the classrooms have been outfitted. So if you can talk to maybe some of those areas and other things that you think about the Dell State response to COVID-19.
Yeah, I think Dell State has been amazing, and what we learned early on was that many who were affected by the virus really had no symptoms. And, they were having a fit that they either had to be put in a quarantine situation or had to go home in some instances. And so what we learned from that was that many of them had a viral load where if they had been in a church or in a classroom and just sneezed, they could have taken out 1, 2, 3 rows of people and gotten them very, very sick. And so we knew then the importance of wearing the mask. And although many of us have been vaccinated and our viral load is not as high, certainly if you get the virus and you are vaccinated, you can have a fair amount of virus in the nose. And what we were hopeful for is that you won't be able to contaminate someone. But it is possible. We have realized that even with those vaccinated, if you've gotten the virus, it's still very, very important that we continue to wear our mask, especially when you're talking about being around young people or the elderly or those that are immunocompromised. And that can be someone as simple as a person that might be a friend of yours that has asthma, for instance, because the mucus that comes with the COVID virus is so viscous. Imagine it's just like syrup in your lungs. And that's why folks are having a very difficult time clearing it because of the viscosity of the mucus and the deadliness of the virus as a result of that. Because if you're not breathing, and even if we put a tube in, if we can't adequately suction the lungs, we could lose you even on a ventilator. And so we've got folks in all kinds of positions trying to get them breathing a little easier. So you're going to need to wear your mask. You're going to need to continue the social distancing. We're trying to get you guys back to some semblance of normalcy. Thank goodness you're at least back among your colleagues, but you just got to be careful because the last thing we want to do is open to close again, because we know the importance of being in school and getting the entire experience being on a college campus, because there's more to it than just the book work. It's really learning how to be an adult and how to manage people and how to manage time. So it's important that you're there.
Thank you. And thank you for bringing up masking. I have a very strict masking policy in our department. They might have thought that we coordinated this, which we did not, but I'm so happy to hear you say that. Thank you. So you went to Tuskegee, I'm an undergraduate, am I correct?
That is absolutely correct. Uh-oh, Dr. Patterson, you froze.
Did I freeze?
There you
okay,
go.
Everything was frozen. Okay, so you went to Tuskegee as an undergraduate, am I correct?
Correct.
Yes. So how did your undergraduate experience at Tuskegee prepare you for the future?
What HBCUs in general do is it is a safe place. It's a happy place. I mean, you don't have to explain yourself to anyone because we just are who we are, and we are the majority. And so folks get it, you know, and so you don't have to talk about your hair. You don't have to talk about the way that your grandmother speaks. You don't have to talk about why you like this versus that, why you look like this versus that. I mean, we just take one another at face value and we embrace what's unique about each of us. So when it came to medicine, especially as a woman of color, you really have to know and be secure with who you are, because there will come, those days where folks will challenge you and quite often every day I hear, right, so you're the doctor. So will you be performing the operation? But, and they say it in kind of a joking way, but you never know exactly what the intention is. But you've got to walk in your favor. You've got to define yourself. And you cannot let some of these microaggressions destroy you. And I will share with you a story that just happened to me this weekend. I had a friend of mine in the hospital, and for the last year, they've been bringing her in and sending her home and bringing her in and sending her home. And it got to the point where she couldn't walk. And her body was in a total spasm. And so she thought she could make it. They sent her home, told her it was an electrolyte imbalance, that she needed to take some vitamins and to see a behavior specialist. And in other words, it's all in your head. You're fine. Take some vitamins. It is what it is. So she called me and was like, can you look at my labs and see what is low so that I can make sure I take the right vitamins? Well, all of her labs were normal. And then the next thing you know, she has a seizure and she's got to be admitted back to the hospital. And she came in at 4 a.m. And by 8 o'clock, they decided, oh, maybe it's time for you to go home. And we had to fight to get her into the hospital. Like, no. You're not going to send her home. We're going to do a workup and we're going to figure out why her body is in a total spasm. and why a 32-year-old woman just had a seizure. Why is that not a big deal? She's got a 5-year-old and a 12-year-old at home. She doesn't do drugs. She's not seeking any pain medicine. She's just trying to figure out what the heck is going on. So by 8 o'clock at night, they hadn't given her anything. And they told her that we're not giving you anything because we need to do a study, something called an EEG, to determine why you had a seizure. And in order to do that, we can't give you anything. Well, by 8 o'clock at night on a Saturday, the likelihood that someone's going to perform that procedure is slim to none. So when her mom called in tears and said her ear is killing her, her whole body is in spasm. Now her face is starting to twitch. I can't even understand what she's saying. And they refused to give her anything. So I called the nurse and I let the nurse know I was on my way and that they needed to get an otoscope in the room and that they needed to talk to the doctor so that some medicine could be given because it was clear that that wasn't going to be a test. And when I got there, the doctor was in the room and the otoscope was in the room. And so I nudged the doctor and I said, can I see you right out here for just a second? So I'm saying to him exactly what I just said to you, like, listen, they've been dismissing her all year long and we need to do this, 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 and this. And now she's in a complete spasm and this isn't fair. And she's a young mother. And why isn't this, managed better? And he looked at me and he said, listen, you're disrespectful, you're rude, and you're unprofessional. And if you don't change your tone, I'm not going to have this conversation with you. And I said, I said, so let me make sure I understand exactly what you're saying. I said, the only thing that is being disrespected at this point is this patient. It's not about me, and it's not about you and your feelings. And he walked away from me and refused to have any more conversation. So I go in, I examine her, I'm talking with her, and then he comes back in the room and he says, I've done a little research and I've got some answers, but I can't share them with you because this doctor was not invited and she has no right to be here. And if she doesn't leave, I'm going to call security. Now, I have privileges at this hospital. I am a physician with a badge, just like anybody else. But for me, it's more about the patient. And I wanted her to get the information. So I said, you know what, guys, I'm going to leave, but you guys get the information because it's more important that you get what you need. So I step outside and I'm talking with the nurse because the nurse was a nurse of color. And I apologized to her first about the way I spoke on the phone because I knew I was just giving orders and because I was on 100 at that point. And I explained to her why I was feeling the way that I was feeling. Because I told her, I said, I have a feeling that if this were not a young mother of color, I think she would have been treated differently. He overheard me talking, came out of the room, went to the phone and called security to escort me out of the hospital. So I'm saying all that to say this. You're going to have to fight for your friends. It's 2021, and I shouldn't have to fight for a 32-year-old mother who just needs some answers, whose body is in complete spasm. The pain is intolerable. She has no idea what's going on, and she had a brand new seizure, and no one seems to be alarmed nor concerned. And so I say all that to say there are going to be days like this when you are going to fight like crazy and you're not going to apologize. And the way that this story ended is the chairman of medicine is a man of color. And he called me back, although he wasn't even in town at 11 o'clock at night. By this point, I'm in tears. I didn't let them escort me out of the hospital. I left the hospital because there was no way security was going to escort me out of a hospital that I had absolute privilege to be in. But I left and I called him and he managed her and she's better. And she called me the next morning and she was in tears. And she said, I don't know what people do that don't have folks like you that they can call on to make a difference in a very short period of time, because I really felt like I was dying and no one seemed to care. So I say all that to say there are going to be good days and there are going to be bad days. And just because many of us are making a lot of progress at this thing called life, please understand that you're still going to be in the fight on a day-to-day basis. And so who you have to know is who you are and whose you are. And when I say who, for me, it's Jesus. You know, I stay prayed up. You must have something higher than yourself that you believe in, that you acknowledge, that you pray to for strength, wisdom, courage, and grace, because that is what will sustain you in this crazy world we call the United States of America and beyond. Trust me on that, and beyond. So you gotta stay ready so you don't have to get ready, because that to me was absolutely unacceptable. And we'll see where it goes from here.
Wow, Dr. Coker. I mean, there's so many things I could say to that. I mean, it just illuminates so many issues, what it means for Black folks, people of color, and working in the profession. And so I'm gonna, and people, if you have questions, you can put them in the chat, and Dr. Burke or I will come to them, and I'll just stop here. I was gonna ask one more question, but I just got to follow up on that. You bring so many important issues, and one of the big things I thought about as you were saying this is health inequity, equity and both inequity. And one of the reasons that I believe that a lot of Black and brown folks, for instance, are not getting vaccinated in certain communities is because of past dealing experimentation, but just dealing with medical professionals. So even in a case like this, you're not getting the care that you should get, or your grandmother or your brother isn't. And so I think that a lot of Black folks, a lot of brown folks, a lot of indigenous people, both in this country and other parts of the world, because if you look at some of the things that people say, there are other things.
Yes.
I'm from Texas. There are members of my family who are anti-vax, for instance. So that's a whole nother issue. But I think a lot of folks, because of experiences and things that they've had firsthand or in their family that have happened, you know, and they didn't have a medical doctor, for instance, who could come in. And, you know, in the way you were treated as a medical doctor. So imagine a layperson who may even, let's say, have a high school diploma. How do they navigate these spaces?
That's right. And that's why very early on in the pandemic, I applaud the National Medical Association, because what they did was they gathered every scientist that had anything to do with this pandemic, and they put all of us physicians of color on a call. And it was blackdoctors.org, and it was called Making It Plain. And we met and we could ask anything, because what we weren't going to be was false prophets. I had no intention on getting the COVID vaccine. I'm gonna say it one more time. I had no intention on getting the vaccine. I went to Tuskegee. I knew about the experiment. I could deal with all the chaos and controversy. And I was like, not me. Somebody can have my spot. You can forget that. And then I'm gonna tell you what changed for me was when it did not come out in time for the national election. And then I knew that science still mattered and that big business was not in the pocket of the current president at that time. And so I jumped on those calls, and we were on for hours, and we talked with Kizzmekia Corbett, and we talked with the CEO of Moderna and Pfizer, and the guy who came up with Operation Warp Speed, and those at the CDC and Fauci. Everybody was answering our calls, because what we knew we had to be was honest, truthful, and we had to have the information that we needed. But what has helped physicians of color more than anyone get the word out and get the trust of the community is, for us, medicine isn't a transaction, it's a relationship. So when my patients come in, I can ask, how was graduation? How was your 50th birthday? How's so-and-so doing in college? So-and-so, because all of that matters. All of that matters. And if you can't take the time to get to know these folks, and then when it comes to a crisis like this, and you think you can just tell them that the vaccine is sufficient and it's going to work, guess again, especially with us. The way that we're treated on a daily basis, especially when it comes to healthcare, pain management, being seen timely, being taken seriously, not being dismissed, who's listening? No one. So that's why we had to get involved, and we started with one church at a time in my office. they would tell us how much we had as far as the vaccine, and then I would contact those churches. And you have to make those kinds of calls because the elderly, especially the elderly African-American folks, I mean, that was conversations that we had to have. Me and my staff just on the phone. Yes, ma'am. No, ma'am. I understand. What about this? What about that? And many of them, 80% of them got vaccinated. But I knew if they did it, it would be helpful to the rest of the family, because grandma made it and I want to be with her and I want to sit with her, but she's not sitting with you after what she's gone through. And you decided I'm not getting vaccinated because I don't believe in that. And I want to make sure about this and I want to make sure about that. But what about me? What about me? So it's been an interesting ride, but for all of us, we knew that our voices mattered. And we knew we could not sit on the sidelines in this pandemic. We had to get involved. We had to roll our sleeves up and be everywhere we needed to be. I've vaccinated in churches, in parks. I've gone to the prison system. I've been everywhere because those that are inmates, they were like, won't be doing that. I mean, you don't need, I said, well, here's the thing, guys. Half the security guards that are working in here with you are not vaccinated. And they're running to Florida and Texas on the weekends, and they'll come in here and take this whole pod out. Are you good with that? Because you got to be good with that because they have a choice. They don't choose to get it. You have to make the choice for yourself because you don't have that many rights in here. But if you're going to be in this kind of quarter with this amount of folks in one small area, and the guard may have just come back from Miami for the weekend, you better make sure you got a weapon in the toolbox because they will take this whole thing out and everybody will just fill it tomorrow with something else. So let's think about what you're doing in here because this is crazy right now that they're not vaccinated. So here they are protecting me as they're walking around with me, but I'm talking about them. But for me, we just got to keep it real. Let's just be honest with one another. Let's just deal in facts and then let the chips fall where they may. That's just the way I work.
Absolutely. Absolutely. Do we have any questions in the chat, Dr. Burke? If not, do you have a question, or Dr. Vatican, some of the students? There are a number of you on the call.
There are none yet posted in the chat. I'll take a minute to defer to anyone who wants to pop on and ask a question.
This looks like a robust little group you guys have here. So from your lens, what do you see about the pandemic, Dr. Patterson, that's interesting in your wheelhouse?
Oh, wow. I didn't know I was going to be on the spot, but I'll be quick. Well, I don't know how much you know about my background. It's largely in African studies and global health, history of medicine. I mean, I knew very early by January that it was coming, for instance. And me and one of our colleagues in the department, who actually is Chinese American and had just come back from East Asia. He'd been to like 4 different countries actually. And he came back mid-January or so. And so we were just talking about it, and we were talking about China's response. And in fact, I think we were probably annoying some people in the department because we were talking about it so much, but we said it's coming. We don't know when, but it's coming. I will say that I knew it was gonna come. I even started hanging things, which is really funny because outside my office is a common space where our work study sits between me and our administrative assistant's office. And there's still flyers up from spring 2020. And there's one, I can't even remember the name before they called it COVID-19, that first name that the World Health Organization gave the holder name, the placeholder name. There's a flyer with that name there. And we have one of the early flyers from the state of Delaware that are still just, they're archives now that are hanging there. So I knew it would come. I didn't imagine, I have to say, looking at it in January 2020, that it would be as bad as it would be. And knowing from a public health lens, global health, public health, the things you need to do to contain a virus, and the frustration of not seeing many of those things happen, or not seeing them happen in a timely fashion. So and that's kind of looking at it way back then. But now I think a lot of it is who's getting vaccinated, who has access to vaccines, both in the US, but also globally, because most of the world is not vaccinated. And as you said at the beginning of this conversation, you're going to have more variants. as the virus continues to circulate, mutate into variants and perhaps eventually another strain or more, what does that look like in terms of prevention, both here, but also globally?
That is the absolute problem. I mean, we are very fortunate now that the vaccines that we have are so efficacious against the current Delta variant. I mean, because that's the same variant that was taking 4,000 people a day out in India. So we feel very fortunate, but what happens when that variant mutates to something that we don't yet have a vaccine for? And then we're back to ground zero where you're filling freezers outside of New York City with bodies because you can't manage them. So we could very easily get back to ground zero. And for many of us right now, I had a 27-year-old that I saw last week and I had to scope him and I couldn't see his vocal cords. As soon as I slipped the scope in, I said,
Wow.
you know, he came in with COVID. He could not lie flat. He could not eat, could not drink. His voice was muffled. And I said, while you have a voice, call your family. And he said, you're scaring me. And I said, I don't mean to. I said, but I can't see your vocal cords. So I know you're going to get intubated probably in the next couple of hours. We're trying to get you together with steroids and breathing treatments. But I want you to call your family and I want you to tell them how you feel and anything you think that you really want them to know, say that. I said, because I don't know how this is going to work out for you. And my prayer is that you make it through this, but we're in a little bit of a trick bag right now. And you know, when you see folks now and they're in the hallways and they're in respiratory distress and the ERs are filling up just like we did back in March of whatever that year was, 2020, 2019, it's all running together now. But you know that it doesn't have to be that way. I mean, it was okay. And we were willing to take the risk because we have taken the oath, you know, to be there for our patients. But now it just feels different. And when I say different, I can tell you somewhat disrespectful. It's like I have a family. I mean, in my house, there is a 8-year-old and an 11-year-old. So now I'm in jeopardy seeing you, but it doesn't have to be because there was an option that could have kept you out of here, you know? And so it's just a very different day right now in the emergency room. We're managing and we'll be there, but just it feels differently this time. I can honestly say that.
Thank you. And it's sobering. And what you were saying too about if there is a variant that comes out where the vaccines don't work as well, and the hospitals are really overloaded in a lot of parts of the country.
Correct.
You know, it's just very sobering. I hope folks are listening to this seriously, what we're saying. And I don't want to scare y'all all to death, but you have to stay vigilant, folks.
Yes.
Dr. Vatican, is that you? Do you want to chime in? Do you have a question? I think you're
Hello, can you hear me now?
Yes.
All right, well, hello, and thank you again for doing this. It's wonderful to hear from you. I did have a couple of things I wanted to bring up. One was I teach critical thinking and I teach logic. And so it's very frustrating for me to always encounter these people, and some of them, like Dr. Patterson, are in my own family, who are very hesitant to take the vaccine. And one of the things that I've gotten out of all of the stuff that I've learned about debating these people is don't approach it like a debate. Because if you start off with disagreeing with them, they're going to see that you're on the other side, and they're going to get their hackles up and they're going to want to disagree so much. Not to say that you should agree with them, but maybe start off with the points of agreement, talk about the stuff that's worrying them and, why they're worrying, and show them that you're actually on their side and you're trying to reach something that, helps people. So that is very hard to do. And I think what you said earlier on really struck a chord. Just keep talking, because every time you discuss with them, it might be the right day. But the other thing, which is a question and not just a comment, is I've heard a lot about the boosters and the boosters coming out. And I was wondering if you had, anything to say about that, because, there's a lot of debate about that as well, whether or not the boosters are going to become available, whether we should be taking them. So I was wondering if you had any thoughts there.
Yeah, the booster is necessary because the holdouts are real. And so when they did a 4-month study, Pfizer did, on healthcare workers, because might as well start with them because they were one of the earliest, we were the earliest group getting vaccinated. And so they looked at the 4-month efficacy rate, and it had dropped from 93% efficacious, working, in other words, to 77%. And so for us, 77%, while still a good number, if that was your test score, you still feel good. You got a C, C plus. But, when you talk about this variant and when you talk about the exposure, because we're back up to seeing 50 patients a day in person, you've got to put a weapon in the toolbox because 77 is just not high enough. In the 90s is much better, especially because you can't easily replace us. I mean, you can graduate some medical students early, but I don't know if I want the medical student replacing the ICU doc. That's not going to work. They're great, and many of them come out amazing, but you got to do some work in order to manage this pandemic. So if that's what we need to do in order to boost our immune system so that we can manage ourselves, especially with the holdouts, and you're right, the holdouts are real. And so there's no shaming when I have these conversations. I just listen. I do more listening than talking because it's important that I listen because I need to know what my approach should be. But with most people, you can talk about someone in their life that means the world to them. And while I drink honey, Joan, and I take this, and I, black cohosh, and you don't understand. And I've never gotten any vaccinations. And I'm like, I get it. But this is a different day, and this is a different dude. So just make sure you're okay with that. And like I said, if you're okay with your life, I get it. Then it is what it is, and you live your life the way you want it to. But we've got 120,000 orphans right now, in this country because they've lost 1, 2, or that only grandparent that was taking care of them. So that's a big, big deal to leave your children when you know that nobody's going to take care of them like you would. So I talk to a lot of these young parents, like, I get it, and I see you, and you look like $1 million, and I agree with you, you're in great shape. But should you not survive it, are you okay with these little munchkins being raised by this or that? And many of them are not. And so you just kind of talk to them about the things that matter outside of themselves. And then you're right. We can make a little headway. But now is the time to do more listening sometimes than talking, and then just chime in where you think it's necessary.
Thank you.
But yay for the boosters. I got my booster. You can believe that. I'm boosted up, and we're getting ready to do a booster event in October because here we go again, folks of color don't trust going to the pharmacy. Are they going to give me Pfizer? They're going to give me Moderna. Is that the J&J back there? They're trying to get rid of it. Did they draw the right amount up? They didn't even ask for me to wait. They just did it and walked back and got my flu shot in one arm and vaccine in the other. And, so if we do it where there's a sense of family and connection, folks just feel better. And we know that, and that's what's necessary. And so we're going to host a booster event in town in Wilmington in October, November, and December. And hopefully at some point, we'll be able to vaccinate these little munchkins between 5 and 11 years of age as well, which would be awesome before Christmas. That's the goal.
Thank you. Jamie Holmes, Ms. Holmes has a question.
Yes. Hello, everyone. Thank you so much. I think this conversation is outstanding. I'm a second-year PhD student in the applied chemistry program. I started research this summer with Dr. Milligan on the impact of hemp and COVID-19, specifically to help treat the inflammation because of the anti-inflammatory response that hemp renders, as well as an immunomodulatory response. My question to you is this. I actually have three, and if you don't mind, I'll be quick so that I could ask them. So based on how the strains are mutating, do you think that we're setting the stage for people to have to continuously be vaccinated or take a booster to be protected from COVID-19? Because I
Yes,
don't
ma'am.
anticipate that this is going away.
You got it. You're absolutely right, Jamie.
Okay.
Yep. Unfortunately, I really do believe that's the stage that we're setting, unfortunately.
Okay. So what in your opinion do you think will be like the long-term effects of continuous exposure from, the vaccine with all populations, but even, specifically with younger people that are women that may want to, of course, are going to become parents,
Yep.
mothers one day, and certainly maybe this information will help me in my research, because again, I'm in that stage of just exploring and doing my lit review.
Right. So the good news is many women got pregnant during the vaccine trials. And that's the
Okay.
only reason why we have any data, because needless to say, although the messenger RNA is a 30 years old, that technology, and it was just waiting for its chance to be used. And the one lady who was up at Penn and then transferred about 3 years ago to Moderna, because Penn was so tired of her talking about the messenger RNA vaccine that they were like, just go. And so she went to Moderna, and lo and behold, we have a pandemic. And oh my goodness, this messenger RNA vaccine is exactly what we need, because the typical vaccine is actually part of the virus genome rendered by putting it in an egg, really. And that's why folks with egg allergies kind of get the flu shot, blah, blah, blah. You put it in an egg to sort of deactivate it, if you will, such that when you put it in someone, you're not necessarily giving them the flu. Well, who's got that kind of time when you've got 500,000 people dead? So the messenger RNA was to the spike protein, that little antenna that's hanging off the molecule of the COVID virus. So those little red hats. And so in other words, when you see this red hat come into the neighborhood, you attack immediately. It's not any part of the genome of COVID in the vaccine because it was too deadly. You can't take that chance. And so it was perfect. And now what's happening is now it's got a green hat, also known as the Delta variant. Now it's got a red, black, and green hat, also known as the Mu. So that's what is happening. So what will happen down the line? I'm not sure. But what we do know, Dr. Holmes, is that what is happening is with COVID, I've got young people that have no memory. I've got young people that can't catch their breath. I had one, I just talked to her mom the other day. I said, how's she making out? Because her taste is so distorted that she's lost 30 pounds over the summer because nothing tastes good. Taste is coming back, but everything tastes like garbage. So she can't eat. And then her mom just told me the other day, she was doing better, Joan. The vitamin that you recommended is working. But guess what? She had a seizure just out of the blue. So
Wow.
What's happening with COVID, especially in those that we are calling long haulers, which means you've got a prolonged decreased ability to smell, taste, I'm out of gas, I have no energy, I'm not breathing like I used to, my memory's not what it was, my lupus is flared up, my tinnitus is crazy. I mean, we got folks coming in, their ears are ringing off the hook. So it's all kinds of things. And the more important question is, what's the long-term effect of COVID is what we're more concerned about. But you're right. The vaccine, at some point, we're going to have to explore that. But right now, what we are seeing real time are the long haulers with COVID. So understanding that information is like, listen, it's worth the risk. It's worth the risk. And many of the mothers who got pregnant during the vaccine trials, their babies had antibodies, which is incredible. What mother doesn't want to have a child right now in the midst of all of this chaos that doesn't have a little weapon in the toolbox? So that's just bonus. Not only did the mom get vaccinated, but the munchkin is born with antibodies. I mean, that's just grace and favor for us because there is no vaccine available for these small babies that have an immune system that's still trying to get its footing, you know?
Okay. And then another question I have is you mentioned not just Delta, but Mu, and I know there's 8 out and other variants. What can we do in our communities to educate people of color? Because I've been having this conversation as a result of my research on the various strands, but most of my family members that aren't in science don't know anything other than Delta, thinking that there's been the original variant and then the Delta, not all the ones in between, and even some of the other ones that are, currently out there. So how can we, because I'm not hearing it on the news.
You're right.
How can we educate, increase education in our community?
I think many of us are going to have to do the lifting. The problem is this: everybody is zoomed out. You know what I mean? Like, oh my God, if I jump on one more
Zoom fatigue, yes.
You know what I mean? Just fatigue. And so churches are open and then they're closed and then they're open and then they're closed. So many are still, and I understand that Seeds of Greatness just last week did something on, the pediatric vaccine that may be coming out, and they did something on the booster shots. And, Seeds is always laying the groundwork, which is just awesome, and doing the work, not just laying the groundwork, but doing the work. So we just have to find a way to keep talking to one another, and whatever that small gathering of individuals is, that's safe and effective. And unfortunately, the Zooms, gonna have to keep meeting through Zoom as well. But it makes it difficult because we're now entering cold and flu season. Folks are going to all kinds of sporting events, concerts, schools back in, and everybody's just walking this tight little line, like, I hope we get to blah, 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 but I'm not sure we're going to make it, but I don't know. And Lord knows if you come up with something, please share it with us, because we'd be more than happy to do it, because
I'm trying my best.
We've done so many webinars at this point, but anybody that asks me to do it, I'm going to make time to do it, because these kinds of conversations are just so necessary.
Absolutely.
Yep.
One final question. You mentioned vitamins.
We have some other
you have
people
other
in the queue. Yes.
Okay. Well, thank you so much for your time.
Thank you, Dr. Holmes. Thank you for all you're doing.
Dr. Burke has a couple of questions, and I think Kamara Kelly is going to ask a question. How are we for time, Dr. Coker?
I'm fine.
Okay. All right. Go ahead, Dr. Burke.
So Dr. Udazulu wanted me to share. Dr. Coker, I just want to thank you for your work. I was one of your patients years ago, and you took care of me when I had sinusitis years ago and eventually had a surgery. Thank you.
You got it.
From Dr. Udazulu.
Thank you, Dr. Zulu.
And then from a student, Mr. Gaspard, is there any correlation between the Moderna vaccine and myocarditis?
We have seen myocarditis with, certainly with COVID, and we've seen it in a lot of young people. But we have seen some inflammatory responses with these vaccines. You're absolutely right. But I will tell you, Moderna is getting the prize right now, because Moderna is actually doing a little better. Got to be honest with you, Marcus, is doing a little better than Pfizer. So can you have some inflammation, which is what myocarditis is inflammation of the muscle of the heart as a result of the vaccine? It's possible. Can you have lymphadenitis? Because folks are coming in with axillary lymph nodes in the neck. We're seeing some with a flare-up of their lupus, a lot of folks with tinnitus. So it does for some that have issues with their immune system, there can be this heightened response to the vaccine. So you're absolutely right. But when you weigh it all out, it's doing more good than harm. But in some instances, you are seeing it, but certainly not enough that we need to pause Moderna or pull Moderna, because Moderna is actually winning the race right now, winning the race.
Dr. Burke, is that it on your end?
There's one more from a Jerish Halsey. Do you think the booster is just as important as the vaccine, and are there more than one type?
No, the booster is just a third shot of Pfizer. That is the only one right now that's been approved. Moderna will probably fall in pretty soon here. I would say probably in the next couple of weeks, because although many of the healthcare professionals may have maintained their antibody levels at 4 months, I got a hunch at 6 and at 8 months, you're going to start to see somewhat of a decline, like down in the 70s again, just like Pfizer. So I would not be surprised if there's a Moderna recommendation pretty soon here. And for those of us in high flow areas like healthcare workers, professors, you guys that are back in school, those of us on the front line, I think even those that work in like Walmart and stocking shelves and seeing folks and folks at the bank, I really do believe that everybody should be on that list. If you are, I'm going to call it a frontline worker, you should get your booster shot. Now, when they talk about the pediatric doses, because we're doing 0.3 units in adults, and it'll be 1/3 of that. So 0.1 units in kids from 5 to 12. So it's not a matter of weight. It is more a matter of age, because you really got to look at what that body can metabolize more so than, oh my God, this is a little 4th grader that happens to be 120 pounds. That doesn't really matter. What really matters is the liver, the kidney, and the ability to process that drug once it's in the system. So from 5 to 11 years old, it's going to be 0.1 units as opposed to the 0.3 that we've used for everyone else. When it comes to Pfizer, the Moderna is actually a 0.5 milligram unit that we've been using.
Thank you. Kamara Kelly has a question, I believe. Is that correct, Kamara?
Sort of, kind of. Hello, Dr. Patterson,
Hello.
the head of my
Hello.
department. I am a freshman political science major here at Delaware State University, and I'm so excited for you to come and talk to us, Dr. Coker. Thank you for spending your time. It's a big question. I'm not sure if you're able to answer it, but hopefully we can take a gander at it. So what kind of political changes or impact do you think that COVID was going to have or is having in our communities, as we've seen COVID kind of target Black and Brown communities throughout the world, but it's particularly, in my perspective, America, because that's where I'm from. It's just, do we have any indicators of people stepping up and presenting public health equitably, rather than just from the perspective of we all have to get this one vaccine and everything on a blanket statement, rather than addressing certain populations? Sorry, someone called me. Did you hear the question?
Yeah, I heard the question, and you're right. That's a loaded statement, but I think you're spot on, because this pandemic has been revealing in so many ways, and many of the things that we have been talking about for years have just absolutely made headlines. And so when you talk about access to healthcare, and when you talk about the ability to get in line, let's just say, for instance, when the vaccine came out, folks could not find the vaccine. And many of them couldn't find it because either their Wi-Fi was inadequate, or they were working job number 1 and then had to quickly get to job number 2. So the question is, when do I have time to sit online, go to all these different sites, log my name in, and respond timely when someone says your number has been called? And so understanding that That's why we had to go the extra mile and create space and opportunity for people. And so the governor even asked me one time, he was like, Joan, how is your office getting 50% of your inventory vaccinated with people of color? I said, because I'm intentional. We are intentional. I said, so that's how it's done. And unless you get as intentional as this virus is, you're not going to get there. Because we can sit here and wait on folks and say it's their fault and, oh my God, they just didn't make it and they just don't want it. No. That wasn't my experience. It was, I'm trying, but I've got this and I've got that, and I'm teaching my kid and I got my mom and they're not well and this and that. You know what I mean? So it was too many balls in the air. So how do we make it easier? How do we make it more accessible so that folks have an equitable chance of getting what they need in order to survive? And so you had to be diligent, you had to be steadfast, and you had to be there wherever that there is. But what this virus has also done has divided this country right down the middle. And where we're happy to be Americans because you have the right to do so many things and do it the exact way that you want to do it, we can see that these civil liberties have really put a line in the sand with a whole lot of folks. But what's interesting is some of the loudest people talking about the hesitancy of this vaccine are vaccinated. So what's really going on? I mean, you know, and that's why you can't take everything that comes across your Google feed, your Instagram, your Twitter feed is truth. Because the same folks that may be trying to keep you from getting vaccinated may be the same ones trying to keep your grandmother from getting in line and you helping her out with a bottle of water. So let's be abundantly clear. It is very interesting, the dialogue that's happening in this country, especially when you talk about this pandemic and when you talk back about vaccinations and you talking about equity in healthcare. It's you got to listen closely and listen to the whole conversation and do a little background check and stop taking everything for face value. And all of these stories are real because everything's not real. That's why I appreciate Marcus saying, hey, Moderna may have caused myocarditis. Yep, Marcus, you may be absolutely right. It may have escalated myocarditis in someone, but has it caused it in so many individuals that we might need to think about bringing Moderna off the shelf? Absolutely not. Nicki Minaj, and she didn't know what Joy, I mean, I don't think she got the magnitude of what Joy Reid was saying, but you just can't say stuff willy-nilly. I heard that my cousin's boyfriend had this and he got orchitis. Let's pull the script. Maybe this is a guy who's been treated for several STDs. So we might not know that this vaccine caused his orchitis. Are you serious right now? And you just want to say that, Nikki, with 22 million followers and we're dying by the day? I mean, we got to be more responsible in our dialogue, and any physician would love to sit down with Nicki Minaj. We'll sit with her any day of the week, answer all her questions. And I think that's the kind of thing, you know, like Dr. Holmes was just asking, how do we do it? Let's get people with all these followers to meet with medical experts, and let's just have you ask the questions and we'll answer them. And then maybe we can reach those that are campaigning outside the CDC, because Nicki Minaj said that the Pfizer vaccine caused orchitis. Are you done? Are you serious? Really? You know, people are dying. So when does it become second-degree homicide at some point? Because what you're saying is absolutely untrue. So when are you going to be held responsible for your loose language? Why doesn't that matter? Can't yell fire in a theater. So why is it okay to say this is wrong and this is right when you really don't even know what you're talking about at all? And I love Nicki Minaj, just like Joy. Joy was like, I love Nicki Minaj. But this is not the time to be reckless. And it's one thing to have an opinion, but it's quite another to speak it like it's fact and then not do the work behind it to say, you know what, let me meet up with some folks. Let me host a webinar. Everybody's doing all these, you know, verses. Let's do this versus that. That's a good versus. Let's bring that on. Fauci versus Minaj. Who's gonna win that? Good luck. Good luck. So yeah, for the politics of all of this, you're in the right area at the right time, because everything has gotten real in this nation. Everything is on the line. Everything. Women's rights, you name it, voting rights, who matters, gerrymandering, are we going to move past global warming? We need all you guys right now, all hands on deck. And the funny thing is, the only thing that keeps us getting up and smiling the next day is everybody on this call. You guys are the future, because we clearly can't get it right. Everybody should be abundantly clear that too many people are just hunkered down and not really listening to one another, not really caring about one another. And we are prayerful that everybody that I saw this summer, raising their voice or through social media or walking the streets, you guys are all that we have right now. And you've had a very different life than we've had, a very different life. So our prayer is that you get it right, because clearly, look at the floods, look at the fires, look at what's happening. And if we don't sit down and get together as one nation globally and look out for one another, we're just moving from one pandemic to the next, one flood to the next, one fire to the next, one, civil rights movement to the next. Seriously, really? Now women can't control their bodies? Got it. Because Roe versus Wade, this is a ticking time bomb right now. Done. Over. And I'm not saying, that I believe everyone should be able to control their body. Everyone. Am I pro-abortion or pro-life? That's not the point. The point is you should be in control. If men were having babies, do you think we'd be having this conversation? I don't think so. Nope. So let's be abundantly clear on what's happening. So yeah, you're coming along at just the right time, Kamara, because this is it. So stay engaged. You're asking all the right questions.
Thank you.
Mm-hmm.
Thank you. And thank you, Kamara, for that question. We have time for one final question. I'd like to give it to one of our undergraduate students if one of you want to chime in. If not, we will take it from anyone in the audience. No takers?
I'm gonna start calling some names. I see your name. No, I'm kidding. I'm joking. Thank you guys for hanging out.
So is that it? Okay. Anyone else? One final quick question. Okay. Well, thank you so much, Dr. Coker. This has been illuminating. I'm glad some of the students did ask questions, but a number of them, as you can see, are on the call.
Oh, yeah.
Been very informative. And it's good for them to hear from someone that's not us, to get a different perspective, I think, about moving forward, both now and moving forward with COVID-19. Do you have any parting words that you would like to leave us with?
I would just say, I think it's time for you guys to lead and not follow. I think all of you are true leaders in your own way. And so if you come up with a creative idea that you want to run past some of us in the medical profession, I mean, I could get a group of my colleagues together and we would love to, host, hopefully at some point, an in-person conversation with you guys about an idea that you may have as a class that might move this country in a better way, especially when we talk about equity in healthcare or anything that you think we might be able to help you move that agenda forward. We would be more than happy to jump on a Zoom and hear you out, or meet with you, hopefully one day in person, mask free, and have a real meaningful conversation. So I say, this is the time to be creative. And this is the time to keep thinking, keep talking, keep leading. You don't have to just follow the norm and what your friends say. And it's time to really step up, be different, and make a difference, more importantly, because I think that the more you guys start getting involved, not only from a voting stance, and I thank you for voting in the last election, but as you can see, is getting more dire, getting more critical. Make sure that you've got all the information that you need to exercise your right to vote in this country, and that your signatures match and all the other little tricks that they have up their sleeve, that your address, you're at the right polling place, all of that, so that you can put the leaders in that you think will move your agenda forward, so that we can get to a better place, because it really, every single vote counted in this last election, and you could see it. I mean, it came down in some counties to 200 votes. So you got to get involved, and you got to stay woke, as you guys say. And like I said, if you've got something that you come up with as a class, and you think that there is some way that we can help you move that agenda forward, I'll grab some of my colleagues, and we'll be more than happy to meet with you, and let's get it done, and let's get it done together. That would be our pleasure.
Well, thank you. Thank you for that invitation to our students. And again, thank you on behalf of the Department of History, Political Science, and Philosophy and the Africana Studies program. We've thoroughly enjoyed it. I see you're getting some hand claps in the chat box. And we look forward to talking to you again in the future.
Perfect. Be my pleasure. Be my pleasure. Thank you, everybody, for the opportunity. Bye now.
Bye.